It is not about telling you what you should or should not do. That's not my place. It is about the truth. It is about awareness. It's about taking something that has been normalized and asking whether it is actually aligned with how you want to feel and how you want to live. Your brain is not broken. Your nervous system is not failing you. It is adapting to what it has been given. And you have the ability to change what it adapts to. Season 2, Episode 5, Alcohol Awareness. The truth we are not telling ourselves. When social drinking becomes neurological rewiring. There is a conversation that happens more often than people realize, and it rarely begins with crisis. It does not always begin with a DUI, a lost job, a broken relationship or hospital visit, or someone finally hitting what the world would call rock bottom. More often, it begins quietly. It begins casually. It begins with someone sitting across from me and saying, I don't have a drinking problem. I just drink. And I always listen closely to that sentence because the sentence itself carries so much. I just drink. Not, I am addicted. Not, I'm out of control. Not, I need help. Just, I just drink. It sounds simple, right? It sounds socially acceptable. It sounds like something that does not require deeper examination because in our culture, drinking is often not treated as a behavior equation. It is treated as a norm really to participate in. But then, if the room is safe enough, if the silence is allowed to linger long enough, the truth actually starts to come forward. I drink to unwind. I drink to sleep. I drink because my anxiety gets so bad at night. I drink because I feel awkward in social settings. I drink because it's the only time I feel relaxed. I drink because I don't know how else to shut my mind off. And that is where the conversation changes, at least for me as a clinician, because at that point, we are no longer just talking about alcohol. We're talking about regulation. We are talking about coping. We are talking about the nervous system. We are talking about emotional pain, stress, trauma, loneliness, anxiety, exhaustion, and the many ways humans begin or beings try to survive when they have not been given enough tools to feel safe inside their own bodies. Listen, here is what I need you to understand from the beginning. Alcohol does not always announce itself as a problem. Sometimes it enters your life dressed as relief. It looks like celebration. It looks like confidence. It looks like connection. It looks like rest at the end of a hard day. It looks like the glass of wine after the children go to bed, the cocktail at the networking event, the drink before the date, the nightcap that helps you fall asleep, the weekend binge that everyone laughs about on Monday. And because it is legal, accessible, socially encouraged, and culturally glamorized, we often fail to recognize that alcohol is not just a beverage. It is a psychoactive substance. It affects the brain. It affects the nervous system. It affects your mood, memory, sleep, hormones, decision making, emotional regulation, and long term health. It can become woven into the fabric of someone's life so quietly that they do not realize it has become less of an occasional choice and more of an emotional strategy. That is why this conversation matters. Because the moment alcohol becomes the bridge between your calm, between you and sleep, between you and confidence, between you and connection, between you and your ability to tolerate your own life, you have to pause. Not with shame, not with judgment, not with condemnation, but with honesty. April is Alcohol Awareness Month, and today we are going beyond the surface. We are not just asking how much people drink, we are asking why they drink, what alcohol is doing inside their brain, how social drinking can gradually become neurological rewiring, and why so many high functioning people do not recognize the impact alcohol is having until they step away from it and finally feel their baseline return. I'm CD Justinsky. I'm a dual board certified family nurse practitioner and psychiatric mental health nurse practitioner. And I'm your host of Healing the Mind and Empowering the Soul podcast. We talk about mental health with honesty, compassion, clinical depth, and spiritual awareness. We talk about what happens in the brain, but we also talk about what happens in the body. We talk about diagnosis, but we also talk about lived experiences. We talk about trauma, patterns, coping, identity, and relationships, and the quiet ways people learn to survive long before they ever learn how to heal. As a dual board certified nurse practitioner in family medicine and psychiatry, I have seen alcohol show up in many forms. I have seen it in the emergency room setting, in outpatient psychiatry, in primary care, in high functioning professionals, in overwhelmed parents, in people with depression, anxiety, insomnia, PTSD, grief, chronic stress, and unresolved trauma. And what I can tell you is this: alcohol is often part of the story long before someone realizes it is part of the problem. Today's episode is not about shaming people who drink. It is not about moralizing. It is not about labeling everyone who drinks as an addicted person. No, that kind of approach does not help people heal. What helps is the truth. What helps is education. What helps is understanding the difference between occasional use, risky use, dependency, and the subtle patterns that lives in between. So today I want us to look closely. I want us to slow down enough to examine what alcohol actually does, why the body responds the way it does, why anxiety and alcohol are so closely connected, why sleep often gets worse even when alcohol seems to help you fall asleep, and why healing requires more than simply saying, just stop drinking. Because if alcohol has been functioning as someone's coping mechanism, we have to ask what pain, pressure, or dysregulation it has been helping them manage. So, I need you to understand that alcohol is a central nervous system depressant. Let's begin with the foundation, right? So, that means it slows down brain activity. It affects communication between your neurons. It alters your neurotransmitters, which are chemical messengers in the brain and body. When someone drinks alcohol quickly begins affecting systems that regulate inhibition, arousal, reward, emotion, memory, coordination, and judgment. One of the main neurotransmitters affected by alcohol is the GABA neurotransmitter. GABA is the brain's primary inhibitory neurotransmitter. In simple terms, it helps quiet things down, right? It reduces neural excitability. It helps the brain and the body move towards calm. Alcohol enhances the effect of GABA, which is one reason people often feel relaxed, less tense, less inhibited, and less anxious after drinking. But alcohol also suppresses the glutamate, right? Which is the brain's primary external neurotransmitter. So glutamate helps you with learning, memory, alertness, and cognitive function. So alcohol creates a double effect. It increases inhibition and decreases excitation. The brain slows down, the body relaxes, the person feels more socially open, more emotionally numb, less self conscious, or less overwhelmed. But here is where the misunderstanding begins. Many people interpret that chemically induced slowing as true calm. But suppression is not the same as regulation. Numbing is not the same as healing. Sedation is not the same as rest. A nervous system that has been chemically quieted is not the same as a nervous system that has learned how to return to safety on its own. That distinction is everything, my dear folks, because when alcohol becomes a tool someone uses to calm down, the brain begins to learn differently, right? The brain is always learning. It learns patterns, it learns associations, it learns what brings relief. So if you repeatedly use alcohol to reduce anxiety, your brain begins to associate alcohol with safety. If you repeatedly use alcohol to fall asleep, your brain begins to associate alcohol with sleep initiation. If you repeatedly use alcohol to socialize, your brain begins to associate alcohol with confidence and connection. Over time, my dear folks, this can weaken trust in your own natural capacity to regulate. You may begin to believe consciously or unconsciously, I need a drink to relax, I need a drink to sleep, I need a drink to be social, I need a drink to feel okay. And that belief becomes part of the cycle. When relief becomes reinforcement, one of the most important clinical concepts is that's in this conversation we're having is reinforcement, right? Alcohol can be reinforcing because it produces immediate effect that feel rewarding or relieving. If someone is anxious and they drink, they may feel less anxious quickly. If someone is stressed and they drink, they may feel temporarily detached from the pressure. If someone is grieving and they drink, they may feel emotionally muted for a moment. If someone feels socially insecure and they drink, they may feel more confident. That immediate relief teaches the brain, oh, this works. But the brain is not only responding to the immediate effect, it is also adapting over time. When alcohol repeatedly enhances GABA and suppresses the glutamate, the brain attempts to maintain balance. The body loves homeostasis, right? It does not want to stay artificially suppressed. So it begins to compensate. It may reduce sensitivity to calming sensations or signals and increase the excitatory activities to counterbalance the depressive or the depressant effect of alcohol. This is one reason tolerance develops. The same amount of alcohol that once produced relaxation may eventually feel less effective. A person may need more to get the same effect. And when alcohol wears off, the rebound can feel uncomfortable. The nervous system may feel more activated, more anxious, more irritable, more restless. Sleep may become disrupted. The body may feel tense. The mind may start to race. And this is where the cycle becomes deceptive. A person drinks to relieve anxiety, then experiences rebound anxiety, then drinks again to relieve anxiety. That has now been intensified by the circle itself. It feels like alcohol is helping because it temporarily removes the discomfort, but it may also be sustaining the very symptom the person is trying to escape from. That is one of the truths we are not telling ourselves enough. Sometimes the thing you think is helping you cope is quietly increasing your need to cope. So we have to talk about this culture that normalizes drinking, right? Now we have to talk about it because no honest conversation about alcohol is complete without naming the environment that surrounds it. We live in a culture where alcohol is attached to almost every celebration. Alcohol, stress, relief. Alcohol, dating. Alcohol, networking. Alcohol, vacation. Alcohol, grief. Alcohol, wedding. Alcohol, funerals. Alcohol, motherhood memes. Alcohol, professional happy hours. Alcohol, holidays. Alcohol. We have normalized alcohol to the point where choosing not to drink often requires explanation. Think about that. A person can say, I'm drinking tonight, and nobody asks why. But if someone says, I'm not drinking, suddenly people want to know a reason. Are you pregnant? Are you on medication? Are you in recovery? Are you okay? Why not just have one drink? That tells us something about the culture. It tells us that alcohol is not just consumed, it is socially protected. And when a substance is socially protected, it becomes harder to question. People may feel defensive when alcohol is discussed, not because they are addicted, but because alcohol has been tied to identity, belonging, pleasure, adulthood, sophistication, freedom, and social ease. So to question alcohol can feel like questioning the ritual people use to connect. But we have to be mature enough to hold two truths at the same time. Some people can drink occasionally without developing dependence, and alcohol can still be harmful, especially when used repeatedly as a coping mechanism. Alcohol can be legal and still be neuroactive. It can be socially accepted and still disrupt the brain. It can be common and still carry risk. So, common does not mean benign. Alcohol and anxiety is one of the most clinically important connections to understand. So what is the relationship between alcohol and anxiety? Many people use alcohol because they feel anxious. They may have generalized anxiety, social anxiety, panic symptoms, trauma-related hypervigilance, chronic stress, or simply an overactive mind that feels difficult to quiet. Alcohol may initially seem effective because it reduces inhibition and dampens, nervous system activation, but over time, alcohol often worsens anxiety. This can happen in several ways. First, as alcohol leaves the system, the brain may rebound into a more excitable state. That rebound can feel like restlessness, nervousness, dread, irritability, or panic. Some people call this anxiety. Hang, like anxiety, that anxious feeling after drinking where the body feels unsettled and the mind starts reviewing everything that happened. For example, it is mild. For others, it is intense. Second, alcohol disrupts sleep, and poor sleep worsens anxiety. When the brain does not get restorative sleep, emotional regulation decreases. The amygdala becomes more reactive. Now, the prefrontal cortex, which helps with rational thinking and impulse control, becomes less effective. So the next day, the person may feel more emotionally vulnerable, more easily overwhelmed, and less able to regulate stress. Third, alcohol can create avoidance. If you consistently drink to manage anxiety, you may not build the internal skills needed to tolerate discomfort. Challenge anxiety thoughts or anxious thoughts, regulate your breathing, calm your body, or remain present through distress. The more you outsource regulation to alcohol, the less practice your nervous system gets in regulating without it. That does not mean the person is weak, it means the brain has learned a shortcut. But shortcuts can become traps. Alcohol and sleep. Now, so let me tell you how alcohol affects your sleep, because this is one of the most common reasons people use alcohol. Many people genuinely believe that alcohol helps them sleep, and in one sense they are not entirely wrong. Alcohol can make you feel sleepy. It can reduce the time it takes to fall asleep, but falling asleep is not the same as staying asleep or sleeping well. Alcohol disrupts sleep, your sleep architecture. As a matter of fact, it can suppress the REM sleep, especially earlier in the night. And as the alcohol metabolizes, it can lead to more awakenings, lighter sleep, sweating, vivid dreams, increased heart rate, and fragmented rest. So a person may fall asleep quickly but wake up at 2 or 3 in the morning with a rapid heart race, right? Or an anxious thought. Or they may sleep through the night but wake up feeling like they never truly rested. This matters because sleep is not passive. Sleep is actually active restoration. It is when the brain consolidates memory, processes emotions, clears metabolic waste, regulates hormone, supports immune function, and restores cognitive capacity. When alcohol interferes with your sleep or your sleep quality, it affects the entire your entire next day. Your mood is lower, anxiety is higher, craving may increase, focus is impaired, patience is reduced, emotional regulations becomes harder. So when someone says, I drink because I can't sleep, we have to ask whether the alcohol is treating the insomnia or perpetuating it. And often the answer is both. It may help initiate sleep in a short term while worsening sleep quality and maintaining the longer term problem. So alcohol and depression also complicates relationships, right? Alcohol and depression has a complicated relationship. Some people drink because they feel depressed. They want relief from emptiness, loneliness, sadness, grief, shame, or emotional heaviness. But alcohol may temporarily create a sense of escape or even mild pleasure. But because alcohol is a depressant, it can worsen mood over time. Alcohol affects neurotransmitters. Okay, the neurotransmitter systems involved in reward, motivation, or emotional balance. It can interfere with dopamine pathways, making natural rewards feel less satisfying. Over time, activities that once brought joy may feel flat. This can deepen the sense of disconnection, right? A person may feel less motivated, less hopeful, less engaged, and more emotionally numb. And emotional numbing can become very seductive, especially for people who are carrying pain they do not know how to process. When someone has unresolved trauma, grief, chronic stress, or internalized shame, alcohol may become a way to create distance from emotions that feel too large to hold. But emotions do not disappear because they are numb. They wait, they accumulate, they return in other forms. Sometimes they return in irritability, sometimes in anxiety, depression, or sometimes as a relationship conflict, right? Sometimes as physical symptoms, sometimes as a quiet loss of self. That is why healing requires more than just behavioral changes. It requires emotional truth. So, how about we also focus on alcohol and trauma? For individuals with trauma history, alcohol can become very, very complicated. Trauma changes the nervous system. It can leave the body in a state of hypervigilance where the person feels constantly alert, guarded, tense, or unsafe. It can also create emotional flooding where feelings become overwhelming and difficult to regulate. For some trauma survivors, alcohol becomes a way to quiet the alarm system. And again, we have to approach this with compassion. If someone has been living with a nervous system that feels unsafe and alcohol gives them temporary relief, we can understand why they reach for it, right? But we also have to tell the truth. Alcohol does not resolve trauma. It delays the body's processing of it. It can interfere with memory integration, emotional processing, sleep, and the development of healthier regulation skills. For some people, alcohol becomes part of a trauma loop. They drink to numb trauma symptoms, then the drinking creates consequences or vulnerabilities that reinforce shame, anxiety, or distress, and then they drink again to cope with that distress. This circle is not about moral failure, it is about pain, meeting an accessible substance in a culture that often teaches people to numb before it teaches them to heal. And that is why trauma informed care matters. We cannot simply ask, why are you drinking? We also must ask, what happened? What are you carrying? What does alcohol help you not feel? What does your body believe it needs protection from? So, this is some clinical insight, right? Let me tell you this. The high functioning pattern. One of the most overlooked pattern I see is the high functioning drinker. And you have heard of this term, functional alcoholics. This is the person who does not fit the stereotype. They are employed, they are educated, they are respected. They may be leaders, parents, professionals, caregivers, entrepreneurs, clinicians, yes, clinicians, executives, or community figureheads, right? They show up, they get things done, their lives does not look chaotic from the outside, but internally, they are exhausted. They may drink every single night, but because they are still functioning, they do not see it as a problem. They may binge on weekends, but because Monday still happens, they minimize the pattern. They may experience anxiety, insomnia, irritability, or brain fog, but they attribute those symptoms to stress, hormones, work, parenting, or life. And sometimes those factors are real, but alcohol may still be amplifying the problem. The high functioning pattern is dangerous because success can become a camouflage, right? People assume that if their life looks intact, their coping must be healthy. But external functioning does not always reflect internal wellness. You can be productive and still be dependent. You can be respected and still be struggling. You can be responsible and still have a relationship with alcohol that is problematic or that is taking more from you than it gives. This is why I always say that we cannot define wellness only by whether someone is performing. We have to ask whether they are present, whether they are regulated, whether they are sleeping, whether they are emotionally available, whether they feel connected to themselves or to others, whether they can tolerate discomfort without immediately reaching for something to change their state. That is the deeper question. Alcohol affects hormones. So let's talk about women, hormones, and alcohol, right? A clinical reality we don't talk about enough. There is another layer to this conversation that deserves attention, especially for my women out there, right? And that is the physiological and hormonal impact of alcohol. Women metabolize alcohol different than men. I need that to sit in with you, okay? On average, women have less body water and different enzymatic activities, which means alcohol becomes more concentrated in their bloodstream than in those of men. The same amount of alcohol can have a stronger effect both acutely and over time. But beyond metabolism, alcohol interacts with hormonal systems in ways that many people do not fully recognize. It can disrupt the balance of estrogen and progesterone, affect cortisol levels, and interfere with the body's stress response. For women already navigating hormonal fluctuations, whether that is premenstrual changes, postpartum shifts, perimenopause, or menopause itself, alcohol can intensify mood instability, worsen your sleep, and increase anxiety. So when a woman says, I feel more anxious lately, or my sleep is off, my mood feels unpredictable. Alcohol may not be the only factor, but it can absolutely be contributing. And because it is normalized, it often goes unexamined. This is not about restriction, it is about awareness. It is about understanding that your body is not neutral in this process. It is responding, adapting, and being influenced by what you introduce into it repeatedly. And when it comes to family patterns and coping, for many people, alcohol is not just a personal habit, it is a learned behavior. It is something that was observed, modeled, and normalized long before it was ever chosen consciously. If you grew up in an environment where alcohol was the primary way adults cope with stress, celebrated milestones, managed conflict, or relaxed at the end of the day, that pattern can become embedded in your understanding of what is normal. Sometimes it looks like subtle exposure. A parent who always had a drink in hand in the evening, a household where alcohol was present at every gathering, a culture where drinking was synonymous with bonding. And sometimes it looks more explicit. A history of alcohol misuse in the family, unresolved trauma, emotional volatility, silence around pain. And what often happens in that is that people repeat patterns they never had the opportunity to question, not because they lack awareness, but because those patterns were never presented as optional. They were presented as the standard. So when you find yourself reaching for alcohol, it is worth asking not only what it is doing for you now, but also what it represents growing up. Was it connection? Was it escape? Was it relief? Or was it avoidance? Because understanding the origin of a pattern is part of breaking it. So, most people who drink also have some emotional or spiritual disconnection. There is a quiet consequences of the use of alcohol that is harder to measure, but deeply important to name, and that is disconnection, not just from others, but from yourself, from your emotional landscape, from your intuition, from your ability to sit with your own thoughts without needing to alter them. Alcohol can create a buffer between you and your internal experiences, right? And why that buffer can feel protective in the short term, right? Over time, it can create distance. You may find it harder to access your emotions without assistance, harder to identify what you are truly feeling, harder to tolerate stillness, harder to be present in moments that are not artificially enhanced. And from an integrative standpoint, this also extends into the spiritual domain. When we talk about healing the mind and empowering the soul, we are talking about alignment, we are talking about clarity, we are talking about being fully present in your own life without needing to escape from it. And anything that consistently pulls you away from that presence deserves to be examined closely. This is not about perfection, not at all. It is about connection. It is about asking whether the life you are living feels the same, feels like something you are fully experiencing, or something you are managing in segments between moments of relief and normalcy, right? So let us talk a little bit about recovery. Now, neuroplasticity, healing, and what actually changes. So we come to the part of the conversation that brings hope, because awareness without hope can feel kind of, I know, heavy. The brain is not fixed, it is adaptive, it is capable of change. And that includes recovery from patterns of alcohol use. Neuroplasticity allows the brain to reorganize itself. When alcohol is reduced or completely removed, the brain begins to recalibrate. Yeah, I like that word, recalibration. Neurotransmitter systems gradually rebalance. GABA and glutamate begin to normalize. The dopamine pathways start to respond more naturally to everyday experiences. Sleep architecture improves, emotional regulations becomes more accessible. Cognitive clarity, yes, it returns. But this process is not immediate. It requires consistency. It requires giving the brain enough time without repeatedly disrupting or disruption to actually stabilize. For some individuals, especially those with more significant patterns of use, there may be a period of discomfort, yes. Increased anxiety, sleep disturbance, irritability, or emotional sensitivity. This is not failure. This is the nervous system adjusting. And for some people, medical support is essential. Yes, withdrawal from alcohol can be dangerous in certain cases. So, this is not a conversation about abruptly stopping without guidance. It is a conversation about informed, supported change. Recovery is not just about removing the alcohol, it is about replacing the function alcohol was serving. If alcohol was helping you manage anxiety, then recovery includes learning how to regulate anxiety in other ways. If it was helping you sleep, then recovery will include rebuilding sleep hygiene. If it was helping you connect socially, then recovery includes developing presence and confidence without relying on a substance. This is where the work deepens, and this is where healing becomes sustainable. Harm reduction versus sobriety, right? What is right for you? One of the most important things to understand is that there is not a single path that applies to everyone. For some individuals, sobriety is the safest and most aligned choice. For others, the process may begin with harm reduction. So, harm reduction, what do I mean? Is reducing frequency, reducing the quantity, setting boundaries, becoming more intentional. The key is to be honest with yourself, not comparison, not minimization, not justification, but honest self assessment. Is your current relationship with alcohol supporting your well being, or is it taking from it? Are you in control of your choices, or do your choices feel automatic? Do you feel better overall, or are you compensating for something that keeps recurring? There is no value in forcing a label. The value is clarity. The value is making decisions that align with your health, your goals, and your long term quality of life. So, this is a reflection I want us to have, the moment of awareness. I think about a patient who once described her experience in a way that captures this entire conversation. She was successful, high functioning, respected, and from the outside, everything looked perfect, stable. She drank wine every single night. It was part of her routine. It was something she told herself she had earned after a long day at work. When we began to explore her anxiety and sleep, alcohol was not initially identified as a factor. It was just part of it. But over time, as we tracked patterns and created space for observation, something became very clear. The nights she did not drink, she slept. After an adjustment period became deeper, she so her anxiety decreased, her mornings felt clearer. And when she finally took a longer break from alcohol, she said something to me that stayed with me till today. She said, I didn't realize how much of my life I was experiencing through a filter until I removed it. That is what awareness does to you, folks. It gives you contrast. It shows you what has been normalized so gradually that you forgot what your natural state feels like. Serenity Healthcare Services supports integrative care. This is exactly what we do here. We approach mental health from an integrative perspective because patterns like alcohol use do not exist in isolation. They exist within the context of your nervous system, your environment, your stressors, your history, your coping strategies, and your goals. We provide care that looks at the full picture, not just symptoms, but also their patterns, not just diagnosis, but life experiences, not just medication when appropriate, but also education, regulation strategies, and support that meets you where you are. Because healing is not about judgment, it is about understanding. So, here is what I want to leave with you. Alcohol Awareness Month is not about labeling people. It is about creating, or it's not even about creating fear, right? It is not about telling you what you should or should not do. That's not my place. It is about the truth. It is about awareness. It's about taking something that has been normalized and asking whether it is actually aligned with how you want to feel and how you want to live. Your brain is not broken. Your nervous system is not failing you. It is adapting to what it has been given. And you have the ability to change what it adapts to. If something, If something in this conversation resonated with you, do not ignore it, sit with it, reflect on it, and ask yourself honest questions. And if you need support, please, by all means, reach for it. Kindly subscribe to our YouTube channel, and so that you don't miss future conversations that bring clarity, insight, and practical understanding to your mental health journey. Until next time, take care of your mind, protect your peace, and honor your healing. This is C.D. Justinsky, and this is Healing the Mind and Empowering the Soul podcast.